Hi, I'm Sheila Davies, the Director of the Dare County Department of Health and Human Services. And today I also have with me Debbie Dutton, our Clinical Services Nursing Director. We want to provide you with some information regarding the current status of COVID-19 in Dare County and provide you with information that you can use to help you and your neighbors remain healthy. Our goal is to slow the spread of the virus, which could lead to fewer sick individuals in North Carolina. We recognize that some of these measures are unprecedented and that this may be a scary situation, but facts over fear is the best way we can all find comfort. I'd like to announce that as of March 13, 2020 at 1 p.m., no individuals in Dare County have tested positive for the coronavirus. We have assisted local healthcare providers in testing individuals that meet the criteria from the CDC and the North Carolina Division of Public Health. We will not be issuing numbers regarding the amount of tests facilitated for the residents of Dare County. We are a small community and we wish to protect the privacy to the fullest extent possible. We have had many inquiries about testing, how we are handling testing. Do we have test kits? Who can be tested? Where can they be tested? And Debbie, I'd like for you to please take a moment to explain some answers and more information about testing.
Sure. So there have been a lot of questions on social media about test kits. I'd like to clarify that test kits are not required to perform testing. Materials used to test for common respiratory viral illnesses can be used to collect the sample for COVID-19 testing. Most, if not all, healthcare providers in Dare County have access to these materials. I'd like to repeat, test kits are not a requirement for someone to be tested. I would like to remind everyone that Dare County Department of Health and Human Services is not a primary care provider. Therefore, we do not offer testing at our Public Health Division locations. Our role is to help providers coordinate and facilitate testing, as well as ensure isolation and monitoring. So far, this has been a true collaborative effort between our department, Dare County's healthcare providers, and the North Carolina Department of Health and Human Services. Testing throughout the state of North Carolina is being taken very seriously. When a person is tested, they are isolated from the public until we receive a negative test result. Individuals testing positive will continue to remain in isolation until they are cleared by public health officials at the state level. These patients will be monitored daily to ensure quarantine and assess their health status. These measures may seem drastic, but these are proven measures that can prevent sick individuals from passing the virus on to others in the community. We are aware that some people have sought medical treatment and have been dissatisfied by not receiving the COVID-19 test. We are working with healthcare providers to assure that the guidelines for testing from the CDC and the NC Department of Health and Human Services are being followed to the fullest extent. There is very specific criteria an individual must meet per the CDC and NCDHHS guidelines to be tested for COVID-19. Individuals with a fever of 100.4 or greater, symptoms of a lower respiratory infection, including cough and difficulty breathing, and a negative flu test will be considered for testing based on your healthcare provider's recommendation. If you are concerned that you may be becoming ill, please keep track of your symptoms and temperatures. This will help medical providers to determine how they should best treat you. If your symptoms are manageable, we recommend that you stay at home and self-isolate. If your symptoms worsen, please contact your healthcare provider. Before seeking medical care, call your provider to alert them of your symptoms. This helps reduce the risk of exposure to other patients and staff. If you are experiencing a medical emergency, please call 911 and tell the dispatch operators of your symptoms.
Thank you, Debbie. Dare County local officials met this morning and agreed to fully support the statewide mitigation guidelines that were made by the North Carolina Department of Health and Human Services to reduce the spread of COVID-19 in order to protect lives and avoid strain on our healthcare system. These measures will be followed for at least the next 30 days. Guidelines include instructing high-risk individuals to stay home as much as possible. High risk includes those 65 years of age or older, or persons with underlying health conditions, including heart disease, lung disease, or diabetes, or persons with weakened immune systems. Congregate living facilities that serve as residential establishments for high-risk persons are directed to restrict visitors. These establishments include settings such as nursing homes, independent and assisted living facilities, correction facilities, and facilities that care for medically vulnerable children. Public Health is assisting local facilities as they take action on the state's recommendations. Another effective control measure is to restrict mass gatherings or events. Organizers of events that draw more than 100 people should cancel, postpone, or modify these events or offer online streaming services. A key message for all community members is to continue to be vigilant with good hygiene habits. Wash your hands frequently, cover your coughs or sneezes with a tissue, disinfect frequently touched items or surfaces, and most importantly, stay home if you're sick. These measures can help prevent the spread of any illness. We will continue to closely monitor this dynamic, evolving situation and provide another update on Friday, March 20th, unless the situation warrants an update sooner. I am confident in the preparedness measures we and our community partners have taken thus far and continue to take. We are following North Carolina Division of Health and Human Services guidelines by taking bold action now to protect the health of our residents and hopefully reduce the spread of COVID-19. Additionally, we are staying up to date on information from the CDC, North Carolina, and our community partners. We invite you to stay up to date by visiting darenc.com/coronavirus or calling North Carolina's coronavirus hotline at 866-462-3821 or calling our local information line at 252-475-5008. Thank you.